Prince Edward Island is the only province that does not cover gender reconstructive surgery. And for our next guest, this became a problem after his mastectomy last January. Jay Gallant says he now feels more disfigured, but he can't fix the problem because he can't afford to leave the province to have the proper procedure done. Jay is joining us from Charlottetown this morning. Jay, good morning. Before you had the mastectomy, you knew the province didn't cover gender reconstructive surgery, but why did you decide then to go ahead?
Well, I was really struggling with what's called gender dysphoria. So there's a disconnect between the gender I was assigned at birth and my actual gender identity. And this causes a great deal of suffering for many individuals. So for me, knowing that I couldn't afford to have the proper surgery done, nor could I afford to just move to another province, I was kind of left in a very difficult position. And it got to the point where I knew I had to make a choice, and I had to do the best, I guess, with what I had. Unfortunately, it wasn't a good situation to be put into, but I had to do kind of the best with it.
So you made the decision to go ahead with the surgery. You also met last June with provincial health officials calling on the province to cover gender reconstructive surgeries. It can cost up to $10,000. What did they tell you at that time?
Well, they told me at first they did believe that they were doing the same thing as other provinces in Canada, but they weren't. And that what they were able to provide is surgeries more like gender removal surgeries, like mastectomies or removal of the penis, removal of testicles, removal of the uterus, those kind of surgeries. So that was what they believed was gender reassignment surgeries. But they're mistaken. According to medical and academic consensus, based on fact-based research, the proper surgical procedure for individuals such as myself, transgender, who are struggling with gender dysphoria, is proper reassignment surgery. So it's actual rebuilding the opposite gender. So for me, it would have been actually creating a masculine chest and saving my nipples. But unfortunately, on Prince Edward Island, none of that is covered.
Well, we reached out to the Department of PEI Health and Wellness. Here's what they had to say in this statement. Plans are being developed to expand coverage for sex reassignment surgery in the province of Prince Edward Island. We anticipate coverage will be expanded in the coming months. Last June, when you met with them, they also said they were looking into it. Do you think they will actually see this through, or is this a delay tactic?
Well, it would be absolutely wonderful if they do see it through. We've definitely presented them with enough information and research of why this is so important. But there has been very little communication back with us, the groups that have gone and met with the Minister of Health and the CEO of Health PEI. We've been getting kind of no response. So it's been very difficult for individuals who are struggling with this, who are looking for answers, and who are coming to me even to see what they should do. And I keep asking them, maybe hold off as long as you can. But having been in that situation myself, that's no easy task. The suffering, the psychological struggles that can happen can have a serious impact on an individual's quality of life. So it's very difficult to tell people, you should just wait. Having no timeline. They were supposed to get back to us in October, but there was just no communication whatsoever, even despite continued emails to them for some kind of response. So it's been a frustrating process for sure.
Jay, thanks so much for joining us to explain more about your situation.
No problem. Thank you.